Hi everyone, my name is Bennion and I am a third year PhD student, and this presentation today is focused on a systematic review I've conducted titled Predictors of Engagement with Between Session Work in Cognitive Behavioural Therapy Based Interventions, a mixed method systematic review and best fit framework synthesis. In the context of psychotherapy, between session work can be broadly defined as the therapeutic work completed by patients outside of treatment sessions during a course of therapy, and can consist of patients reading over psychoeducational materials or completing thought diaries, writing down any troublesome thoughts or worries which present throughout the day. Between session work is considered a core and crucial feature of CBT and has been since CBT was established, as it acts as a vehicle to help patients translate the contents of treatment sessions into those cognitive and behavioural changes within everyday life, which is an important goal in CBT. Between session work also acts as kind of a way for patients to collect any pertinent information to treatment, which simply couldn't be collected during treatment sessions. Thinking about between session work in the context of England, nationally implemented by NHS England in 2008, was the Improving Access to Psychological Therapies programme, or IAP programme, which sought to improve the delivery of and access to evidence-based psychological treatments, and is now considered one of the main providers of mental health support in the UK. In line with the step care model, which offers the least intrusive but most effective intervention first, most individuals accessing IAP services are offered low-intensity CBT in the first instance, which compared to more traditional high-intensity CBT is shorter in duration, meaning treatment sessions are shorter and the kind of whole course of treatment is shorter as well. So there's a heavier reliance on so-called health technologies such as self-help materials or online platforms to facilitate that learning of adaptive coping strategies. And given the reduced amount of time spent actually in session with your practitioner during a course of low intensity treatment, between session work makes up a substantial part of the therapeutic activities which take place over treatment. And you can see the kind of comparison of the time spent in session to the time spent engaging with between session work on the bar chart on the screen there. The majority of the previous research which has taken place on the topic of between session work in CBT has identified the relationship it has with treatment outcomes, in which several meta-analyses have evidenced both positive associations between both the use of and engagement with between session work and treatment outcomes. But unfortunately, another thing that the current evidence has highlighted is that current levels of engagement between session work vary substantially across patients. And we know this both from the research, but also anecdotally if we talk to practitioners across services. So studies sought to explore factors which affected patient engagement with between session work. However, the findings of these studies have been inconsistent, contradictory, and all in all inconclusive. So to address the current evidence gap concerning the factors affecting patient engagement with between session work, we conducted a mixed method systematic review and best fit framework synthesis, exploring the predictors of engagement between session work in CBT-based interventions. And it's really important we better understand these factors so we're able to put measures in place to enhance engagement and thus treatment outcomes. Now, the diagram on the slide depicts the process of the review and best fit framework synthesis. And what the addition of the best fit framework synthesis allowed us to do was to consider any relevant underpinning theory to engagement with between session work throughout the review process, and involved us identifying any relevant conceptual theories, models, or frameworks in which we could use as a coding framework to map the findings of the primary studies onto. Now, the coding framework remained flexible in that new themes could be created for any evidence from the primary studies which didn't appear to map on the theoretical coding framework. So the final output of the review is a conceptual model that's both theory-driven, but also based on empirical evidence. So this shows the kind of current model of explored predictors of between session engagement in CBT. And to pick out one of the main key findings, seemingly the most explored predictors of engagement was those related to patient symptomology. So for example, looking at things like whether depression severity or whether the patient had any comorbidities affected engagement with between session work. Now, the 26 quantitative studies which explored factors relating to patient symptomology mostly found non-significant associations with engagement with between session work. And those which found significant associations, the direction of effect differed between studies. So some found a positive relationship to engagement between session work, and some found that a negative relationship between session work. So from the quantitative findings, there really isn't any clear predictors related to patient symptomology there. But out of the 4 qualitative studies which were involved, 3 outlined factors relating to patient symptomology affecting that engagement between session work. So there seems like there's a bit of a discrepancy there between quantitative and qualitative findings. Some things to highlight when interpreting the findings of the review is that it highlighted that lack of research on the topic of between session work in that low intensity context, but also in that UK context. The data was predominantly quantitative with a lack of qualitative research, and also the review sample was mainly white and Western, which is really important to highlight when predictors such as ethnicity or cultural beliefs have been explored within included studies. In terms of next steps, in order to test the findings of the review in a UK and NIHR context and to further build on the model, I'm currently conducting a qualitative study involving exploring NIHR patient and professional perspectives regarding engagement between session work. And you can also see some of the recommendations for future research prompted by review findings on the screen there. So thank you so much for listening, and any questions, please let me know, or alternatively, you can send me an email. Thank you very much.